So now we're going to start spinal cord. Okay. So we're going to draw one line diagram and then we're going to proceed. Now this is our spinal cord. See, spinal cord is starting from C1 to L1. Now this is the spinal cord starting from C1 to L1. Now C1 to lower border of L1. Lower border of L1. Now please remember, spinal cord is not passing through foramen magnum. The one which comes out of foramen magnum is called spinal cord. Then who is passing through foramen magnum? The lower end of medulla. Okay, so if you want you can write, otherwise leave it. The lower end of medulla, which passes through foramen magnum. So spinal cord is not passing through foramen magnum. Okay. Now again, in the exam they ask you specifically from C1 to lower border of L1. Lower border of L1. Now in the case of newborn, the CSF is starting from C1 to upper border of L3. So please write the spinal cord in adult C1 to lower border of L1. Now in the case of newborn, spinal cord is extending from C1 to the upper border of L3. Okay. Now what about the pyometer? Now the lower end of spinal cord is called conus medullaris. The lower end of the spinal cord is called the conus medullaris, the triangular part. Okay. Right. Now what about the pyometer? So pyometer, which extend up to L1 and from here which goes up to coccyx. Now from L1 up to coccyx, now this extension of pyometer is called phylum terminal. Phylum terminal. Okay, right. Next, arachnoid membrane. So this side also we draw the pyometer. Okay. Next, arachnoid membrane. Now the arachnoid membrane which end at S2, the lower border of S2. This is the arachnoid membrane. So arachnoid membrane which is ending at the lower border of S2. So now please write pyometer which ends at coccyx. Okay, arachnoid membrane is ending at lower border of S2. Now between the arachnoid membrane and the pyometer, we have subarachnoid space. So arachnoid membrane is ending at the lower border of S2. So subarachnoid space is ending at lower border of S2. This is subarachnoid space. So subarachnoid space also ending at lower border of S2. Right. Now we're going to take CSF for culture and sensitivity. Now, so lumbar puncture is done at before S2. The ideal site is between L3 and L4 or L4 and L5. This is the ideal site to do lumbar puncture. Okay, right. Now, what about the dura mater? I told you the cranial dura is two-layered, whereas spinal dura, it is single layer. Spinal dura is single layer. Now, single layer means we don't have dural venous sinus. No dural venous sinus. Now, spinal dura, which converge at S2 and ends at coccyx. Okay, so our dura mater is single layer which is converging at S2 and which comes up to coccyx. Okay, right. This is our dura mater. Okay, so this is about the extensions of the spinal cord. Okay, right. Now next, see the diagram. Now in this diagram, yes, we are seeing the spinal cord which is extending from C1 and which end at the lower border of S1. The lower triangular part of the spinal cord is called conus medullaris. Right. Now see the diagram. Now in the diagram, we are seeing two enlargement, cervical enlargement and lumbar enlargement. Now cervical enlargement and lumbar enlargement to supply the upper limb and the lower limb muscles. Okay. Now the cervical enlargement, the C4 to T2 nerves arising from that. The spinal segment of the cervical enlargement is C4 to T2. That means C4 to T2 fibers is arising from cervical enlargement. Now what about lumbar enlargement? Lumbar enlargement is L2 to S3 fibers arising from lumbar enlargement. The spinal segment of lumbar enlargement is L2 to S3. Okay, right. Now we're going to see two more terminologies. One is conus medullaris and the cauda equina. Now conus medullaris, I told you that is the lower terminal part of the spinal cord. Okay. Now what are the spinal segment? What are the spinal nerves arising from the conus medullaris? Sacral fibers and coccygeal fibers. Sacral and the coccygeal nerves arise from conus medullaris. Now we have one more terminology, that is our cauda equina. Now what is cauda equina? Cauda equina is nothing but the lower bunch of the spinal nerve. That is the lower bunch of the spinal nerve. Lower bunch of the spinal nerves. That is called cauda equina. Okay. So the lower bunch of spinal nerves called cauda equina, from which nerves are? From L2 to coccygeal nerves. So from L2 to coccygeal nerves, yes, the lower bunch of the spinal nerves, they're called cauda equina. So remember these two terminologies. Right. Next, we're going to see some modifications of the pia mater. Now we have two modifications of the pia mater. One is our phylum terminal. There's a modification of pia mater. Now one more modification of pia mater is ligamentum denticulatum. See, name itself you have a clue. Ligamentum denticulatum. It is a tooth-like extensions. Now how many ligamentum denticulatum we have? One on either side, right side and left side. So we have two ligamentum denticulatum on the right side and left side. On each side we have 21 tooth-like process. On each side, now can you see here? So on each side we have 21 projections attaching to dura, attached to the inner part of dura. Okay. Now this ligamentum denticulatum, which is present between the ventral root and the dorsal root. It is present exactly between the ventral root and the dorsal root. Now again, so it is present exactly between the ventral root and dorsal root. So now this ligamentum denticulatum surgically is important landmark to identify the ventral root and the dorsal root. Okay. So the ligamentum denticulatum, which serves as neurosurgical landmark in the spinal cord surgery. Okay. So ligamentum denticulatum, it is the neurosurgical landmark in the spinal cord surgery. Okay. Right. That's all. Now next. Now we're going to take the cut section of the spinal cord. Okay. So now we're going to take the cut section of spinal cord. Now if you take the cut section of spinal cord, then the diagram will be like this. So see the diagram. Now in the cut section of spinal cord, now this is the anterior horn and this is the posterior horn. Now this is the gray matter. Okay, so gray matter is present inside the spinal cord. Now we draw a diagram, basic line diagram. Now this is our spinal cord, cut section of spinal cord, and this is the gray matter. Gray matter is H shape or butterfly shape. Now we also have the lateral horn. Lateral horn is not present through the length of spinal cord. specifically it is present. Okay. Now this is the gray matter. So gray matter shape is H-shaped gray matter. H-shaped gray matter. Right. Now we have, this is our posterior horn. This is anterior horn. And this is lateral horn. Okay. Now posterior horn is sensory in function. Posterior horn is sensory in function. Anterior horn, it is motor in function. That means the sensory nucleus present in the posterior horn and motor nucleus present in the anterior horn. Okay. Now what are the nucleus present in the posterior horn? Now in the posterior horn, we have number one, substantia gelatinosa. This one, that is the substantia gelatinosa. Substantia gelatinosa. Okay. Now behind the substantia gelatinosa, we have nucleus propyrus. We have nucleus propyrus. This is nucleus propyrus. Okay. And behind that, we have a Clock's column. Behind, we have the Clock's column or nucleus dorsalis. Nucleus dorsalis or Clock's column. And just lateral to that, we have visceral afferent nucleus. This is visceral afferent nucleus, which carries the afferent fibers from the organs. Okay. Right. Now, substantia gelatinosa. Substantia gelatinosa, it is the nucleus for spinothalamic tract. So, substantia gelatinosa, which is the nucleus for spinothalamic tract. Okay. Now, nucleus propyrus, it is the nucleus for dorsal column tract. Dorsal column tract. And nucleus dorsalis or Clock's column, it is the nucleus for spinocerebellar tract. Spinocerebellar tract. Visceral afferent, which carries afferent fibers from the organs. Okay. Now, in the lateral horn, we have two nucleus. Medial nucleus, and lateral nucleus. I am writing as this is M and this is L. So, medial nucleus for parasympathetic system. Medial nucleus for parasympathetic system and lateral nucleus for sympathetic system. Okay. So, mnemonic is MPLS. So, medial nucleus for parasympathetic system and lateral nucleus for sympathetic system. Right. Now, come to anterior horn. See, anterior horn, it is motor in function. We have motor nucleus. Again, we have three nucleus: medial nucleus, lateral nucleus, and the intermediate nucleus. So, we have three nucleus: medial, lateral, and intermediate. So, this is medial nucleus, lateral nucleus, and the intermediate nucleus. Okay. So, medial nucleus, it is for innervating the axial muscles, and lateral nucleus, it is for innervating limb muscles, and the intermediate nucleus, it is for the nucleus for phrenic nerve and spinal accessory nerve. Now, phrenic nerve C3 to C5, nucleus for spinal accessory nerve C1 to C5. Okay. Now, these are all the various nucleus present in the spinal cord. Now, this is the basic outline of the spinal cord. Now, we're going to discuss about the tracks. So, gray matter over. Now, we're going to see the tracks, the white matter. So, these are all the white matter. These are all the white matter. So, this entire thing. So, this is a white matter. So, the white matter, who is passing? Tracks are passing. We have two tracks. What are those? The ascending tracks and the descending tracks. So, next we're going to start the discussion about the tracks, descending tracks and the ascending tracks. Now, descending tracks, it is coming from the cortex to spinal cord. That is corticospinal tract. That is corticospinal tract. Now from the cortex to the cranial nerve nucleus, that is cortico-nuclear tract. Okay. Now the cortico-spinal tract and the cortico-nuclear tract together they are called pyramidal tract. So what is the function of pyramidal tract? To do fine movement, distal movement, skilled movement, and the voluntary movement. Now for example, you are taking notes. You are using your fingers, distal movement. You are writing, fine movement, skilled movement. It is under your control, voluntary movement. So pyramidal tract contains corticospinal tract and the corticonuclear tract, which helps to do fine movement, distal movement, skilled movement, and the voluntary movement. Now remaining all the tracts, the rubrospinal tract, rubrospinal tract, rubrospinal tract, and tectospinal tract, and vestibulospinal tract. And we also have one more tract, reticulospinal tract. Okay. Now these four tracts, rubrospinal, tectospinal, vestibulospinal, and reticulospinal, they are called extrapyramidal tract. They are extrapyramidal tract. Now what is the function of the extrapyramidal tract? See, extrapyramidal tract, which plans the movement, which modulates the movement, which programs the movement, Okay. So the extrapyramidal tract, it helps to plan the movement, program the movement, modulate the movement. Whereas the pyramidal tract helps to do the movement. Okay, right. Now see the diagram. Now we have corticospinal tract. Corticospinal tract we have two, lateral and anterior corticospinal tract. Lateral and anterior corticospinal tract. Okay, right. Now extrapyramidal tract, we have rubrospinal tract, vestibulospinal tract, reticulospinal tract, and the tectospinal tract. Now see the diagram. Now all the extrapyramidal tract, it is present in the anterior white column. This is anterior white column. So please write all extrapyramidal tracts present in anterior white column except one tract. See the diagram and tell me. Only one extrapyramidal tract, it is present in the lateral white column. What is it? Very good. Our rubrospinal tract. Except our rubrospinal tract, which is present in the lateral white column. Okay. Shall we proceed? Now, next one. Now, in the pyramidal pathway, in the pyramidal tract, we have two types of motor neurons are present. The upper motor neuron and the lower motor neuron. Okay. So now, in the pyramidal pathway, we have upper motor neuron and the lower motor neuron. So in the pyramidal tract, we have corticospinal tract and corticonuclear tract or corticobulbar tract. The upper motor neuron in both the tracts, corticospinal and the corticonuclear tract, which is present in the cortex. Okay, the upper motor neuron. Now fibers from the upper motor neuron which come to lower motor neuron. Now the lower motor neuron for the corticospinal tract. See, this is the descending tracts, motor tract. Now motor nucleus are present in which part of the spinal cord? Very good. The anterior horn, motor nucleus in the anterior horn. So the lower motor neuron for the corticospinal tract, it is present in motor nucleus in the anterior horn of the spinal cord. Now fibers from the motor nucleus of the anterior horn of spinal cord, which nerve will arise? The spinal nerve will arise, which in turn supply the target muscles. Clear? Right. Now what about the corticonuclear tract? Now corticonuclear tract from the cortex to motor nucleus of the cranial nerves in the brainstem. Now from the motor nucleus, the cranial nerves arise and in turn supplies the target muscles. Clear? Right. So now the fibers from upper motor neuron come to lower motor neuron. Now fibers from lower motor neuron go to target muscles. So upper motor neuron, it is not having the direct control over the target muscles. See, upper motor neuron, it is having the influence over the lower motor neuron. Lower motor neuron having the connection to target muscles. Okay. Right. Now, for example, now we see the pathway for the hypoglossal nerve. Now, hypoglossal nerve, the upper motor neuron present in the cortex. Lower motor neuron for the hypoglossal nerve is present in the motor nucleus, hypoglossal nucleus in the medulla. From the hypoglossal nucleus, which nerve will arise? Hypoglossal nerve arise, which in turn supply target muscles, tongue muscles. Similarly, for third nerve, again upper motor neuron in the cortex. Now from the upper motor neuron, the fibers are coming to the oculomotor nucleus in the midbrain. Now from the oculomotor nucleus, oculomotor nerve arise, which in turn supplies extraocular muscles except SO4 and LR6. Clear? Very simple. Now what about the corticospinal tract? Corticospinal tract, again upper motor neuron in the cortex. We see for phrenic nerve. Now from the cortex, the fibers are coming to motor nucleus, that is C3, C4, C5 nucleus in the spinal cord. Okay, from there phrenic nerve arise and supply the diaphragm. Okay, right. Now, what is the function of upper motor neuron and lower motor neuron? Now, please remember, lower motor neuron do overaction. Okay, now upper motor neuron having the connection to lower motor neuron. Now, the best example for the lower motor neuron, you can think of any hero heroines do overaction. Okay, so what the upper motor neuron, what the directors and the producers of the movie will do, they control the overaction of the hero heroines. Now, from the lower motor neuron, the fibers are given to target muscles. Fine. Now we have a problem. The problem is that movie is directed by the overacting hero heroines only. Now what happened? Now we have the lesion of upper motor neuron. So there is no one to control the lower motor neuron. So lower motor neuron, the hero heroines, what they do? They do overaction, song, fight, everything will increase. Yes or no? Yes. Same way, in the case of upper motor neuron lesion, there is no one to control the lower motor neuron. No one to control the hero heroines do overaction. So in this case, now what type of paralysis you get? Yes, very good. Spastic paralysis. What happened to the tone? Tone will increase. What happened to the reflex? Reflex will increase. The Babinski sign will be, yes, positive. Now what about LMN lesion? Now we have a lesion in the lower motor neuron. So no fiber will go to the target muscles. Okay? No fiber going to target muscles means, now what type of paralysis you get? Flaccid paralysis. What happened to the tone? Tone will decrease. What happened to the reflex? Reflex will decrease. And the Babinski sign is negative. Clear? Very simple. Okay, right. So next, we're going to write one important point and we're going to draw one diagram for that. Note. Okay. All the motor nucleus of cranial nerves which are controlled by bilateral cortex except the lower part of facial nucleus, which is controlled only by opposite cortex. You write this statement and we'll draw one diagram for this. Okay, so all the motor nucleus of cranial nerves controlled by bilateral cortex, both cortex, right cortex and left cortex, except the lower part of facial nucleus, which is controlled only by opposite cortex. Clear? Shall we proceed? Now we're going to draw one diagram for this. What diagram? See here. Now we're going to draw one diagram. Now this is our cortex. This is right cortex A and this is left cortex A. Right cortex and the left cortex. Now right cortex, below that we see the facial nucleus. This is our facial nucleus. This is right facial nucleus and this is left facial nucleus. And we are dividing the facial nucleus into upper part and the lower part of facial nucleus. I told you the lower part of facial nucleus, which is controlled only by opposite cortex. So right nucleus lower part, which is controlled only by left cortex. Now right cortex control the left nucleus lower part. Left cortex control the right nucleus lower part and the right cortex control the right nucleus lower part. Okay, right. Now what about the upper part of the facial nucleus? I told you all the motor nucleus are controlled by bilateral cortex except the lower part of facial nucleus controlled by opposite cortex. So here both right cortex and the left cortex will give the fiber. Similarly here left cortex and the right cortex will supply the upper part of facial nucleus. So upper part of facial nucleus, it is controlled by both right and left cortex. Now next we're going to draw a face. Now this is face. We're going to divide the face into right half and the left half. Okay. So now fibers from the upper part of the nucleus come to upper part of the face. Now fibers from the lower part of the nucleus control the lower part of the face. Now by this we are dividing the face into 4 quadrants. Okay. The upper part of facial nucleus control the upper part of the face and the lower part of the facial nucleus control the lower part of the face. Clear? Right. Now we're going to proceed. So this is the diagram for the statement we have written. Okay. Now we're going to see the lesions, the upper motor neuron lesions. Now lesion in left cortex. Listen, please don't write. Listen. Now lesion in the left cortex. Now lesion in the left cortex means now which part of the facial nucleus affected? Only this part. Which part? Right nucleus lower part is affected. Now right nucleus lower part affected means then which side of the face affected? Right side of the face, the lower part. Why? The lower part of the nucleus control the lower part of the face. So lesion in the left cortex. Now where is the effect? On the right side. Right side, entire half of right side. No, only the lower part of the right side. So that is the feature you see in the UMN lesion of facial nerve. So UMN lesion, upper motor neuron lesion of the facial nerve. Now where is the effect? Opposite side. Contralateral side, lower half of the face is affected. Lower half of the face is affected. Okay. Shall we proceed? Right. Next one. We're going to see the LMN lesion of facial nerve. LMN lesion means nucleus, motor nucleus of the cranial nerve. So now we have a lesion in the nucleus. Left side facial nucleus is gone. Then left side facial nucleus gone means left side of the face is affected. Again, the entire half, because we have the lesion in the entire left nucleus. So the entire half of the left is affected. Okay. So LMN lesion of the facial nerve. What is the feature? The ipsilateral side, the entire half of the face is affected. Ipsilateral side, the entire half of the face is affected. Clear? Shall we proceed? Yes. Now this is about the UMN and LMN lesion of facial nerve. Very important. You may get this in the exam. Okay? Right. So now we're going to discuss the corticospinal tract and the corticonuclear tract. Pyramidal tract we will discuss. Okay. So the corticospinal tract and the corticonuclear tract, the origin is from the 30% of fibers. The pyramidal tract is arising from primary motor area. Now another 30% of fibers of pyramidal tract is arising from premotor area, and the 40% of fibers of the pyramidal tract is arising from primary sensory area. Now this is question. Now see the statement. The highest individual contributor for the corticospinal tract is our primary sensory area. 40% of fibers is arising from your primary sensory area. Okay. So now the pyramidal tract arising from 30% from primary motor area, another 30% from premotor area, but 40% fibers, it is coming from primary sensory area. Now in the exams, they may give you the statement. So the highest individual contributor for the pyramidal tract is primary sensory area. That is a correct statement. Okay, right. Now from which cell this takes origin? From the giant cell of Betz. It is coming from Betz cells. Okay. Now from the Betz cells, then the fibers passes through midbrain in the cerebral peduncle of midbrain, and then passes through pons, and then passes through medulla. Now in the lower medulla, we see the decussation of pyramid. Okay, so please write in the lower medulla, the decussation of the pyramidal tract. Okay, decussation of the pyramidal tract. Now, how much percentage of fibers will cross, sir? 80% of fibers will cross, and they continue as lateral corticospinal tract. 20% of fibers, they are not crossing in medulla, and they are anterior corticospinal tract. Okay, so lateral corticospinal tract, it is the cross tract in the medulla, whereas the anterior corticospinal tract, which is uncrossed tract in the medulla. Now how much percentage of fibers will cross? 80% of fibers will cross, and 20% of fibers uncrossed. Clear? Right. Now next one. Now after the crossing, now the lateral corticospinal tract, which descend and end in the motor nucleus in the anterior horn of the spinal cord. Motor nucleus in the anterior horn of the spinal cord. Mainly to which nucleus? We have three nucleus, no? Lateral, intermediate, and medial. So lateral corticospinal tract, which go to lateral nucleus. I told you already, lateral nucleus for innervating the limb muscles. Okay, right. Now anterior corticospinal tract, I told you it is not crossing in the medulla, but it comes all the way down to spinal cord. Now see here, I'm putting round now. Now see inside. Now that is the anterior corticospinal tract. After coming to spinal cord, it is crossing and reach the medial nucleus. Okay, so anterior corticospinal tract, which cross to opposite side, in the spinal cord, and reach the medial nucleus in the anterior horn of the spinal cord. Again, medial nucleus to nervate the axial muscles. Yes. Shall we proceed? Now the point is 100% of fibers, that is all the fibers of the corticospinal tract, they cross. 80% fibers, they cross in medulla, and 20% fibers, they are crossing in the spinal cord. So decussation is 100%. Okay. Now this is about the corticospinal tract. Now any injury above the decussation of the pyramid in the medulla, the effect will be on the opposite side, contralateral weakness of muscles. Please write. Applied. Okay. Now, so any injury above the medulla decussation. So any injury above the medulla decussation, the effect will be on the opposite side. The patient have contralateral weakness, contralateral hemiplegia. Okay. Now any injury in the spinal cord, any injury to corticospinal tract, now below the decussation of the medulla in the spinal cord, now the patient have ipsilateral same side hemiplegia. the spinal cord, same side hemiplegia, same side weakness of muscles. See the diagram? Now we have a lesion in the spinal cord. Okay, now we have a lesion in the spinal cord. Now from this side, no fiber will be coming out. So the muscles present on the same side will be affected. So ipsilateral hemiplegia due to the injury of the corticospinal tract in the spinal cord. Clear? Right. That's all about the corticospinal tract. Now that's all about the descending tracts. And next we're going to see the sensory tracts. Okay, ascending tracts. Now ascending tracts. So we have lateral spinothalamic tract. Okay, and ventral spinothalamic tract, and the dorsal column tract, and we also have spinocerebellar tract. Okay, so spinocerebellar tract, these two. This is ventral spinocerebellar tract, and this is dorsal spinocerebellar tract. Okay, right. Now first you have to know the functions of these tracts. Now number one, the lateral spinothalamic tract. The lateral spinothalamic tract, okay, which is carrying the very basic sensation. Now the very basic sensation is pain and temperature. Pain and temperature is a very basic sensation which is carried by lateral spinothalamic tract. Okay, and next one is the anterior spinothalamic tract. Now anterior spinothalamic tract, which carries crude touch and pressure. Which carries the crude touch and the pressure. Next one, your dorsal column tract. See, dorsal column tract which carries fine touch. Very important. See, crude touch is carried by anterior or ventral spinothalamic tract, whereas dorsal column carries fine touch. Very important. Fine touch, vibration, joint sensation, touch localization, stereognosis, and then the conscious proprioception. So all the higher sensations are carried by dorsal column tract. And we also have the spinocerebellar tract. Now spinocerebellar tract which carries unconscious proprioception. Okay, yes. Now these are the sensory modalities carried by the ascending tracts. Now next we're going to discuss all these tracts: spinothalamic tract, dorsal column tract, and the spinocerebellar tract. Yes, we see one by one. Now the spinothalamic tract and the dorsal column tract, they start from spinal cord. In the spinal cord, dorsal root ganglion, and that is the first order neuron. Now from here, the fibers go to second order neuron. See, I'm not writing the second order neuron specifically, just basic outline only. From the first order neuron, the fiber go to second order neuron. Okay. Now please remember, fibers from the second order neuron cross to opposite side. Okay, fibers from second order neuron cross to opposite side, and then they go up to thalamus. Now thalamus, we have a nucleus. Which nucleus? VPL nucleus, ventro-postero-lateral nucleus. Now from ventro-postero-lateral nucleus, the fibers are given to sensory cortex. Now sensory cortex area number 312, that is our post-central gyrus. Okay. Now this is the basic outline of the spinothalamic tract and the dorsal column tract. So first order neuron in the dorsal root ganglion. Now fibers from the first order neuron go to second order neuron. Please remember the second order neuron, fibers from second order neuron cross to opposite side. Very important. Not first order neuron. Fibers from second order neuron cross to opposite side and they go up to thalamus. Now thalamus, we have a nucleus. Which nucleus? VPL nucleus, and that is the third order neuron. Now fibers from VPL nucleus, which in turn go to sensory cortex. Clear? Any doubt? No. This is a basic outline. Now we're going to start our dorsal column tract. Again, the first order neuron present in the dorsal root ganglion. This is our dorsal root ganglion. Now fibers from the first order neuron now ascend. Now we are seeing dorsal column tract. Now fibers from the first order neuron, dorsal root ganglion, ascend up to medulla. In the medulla, we have two nucleus. What are those? Dorsal column nucleus. We have nucleus gracilis and lateral one is nucleus cuneatus. Nucleus gracilis and nucleus cuneatus. We have dorsal column nucleus in the medulla. Now medial one is nucleus gracilis and lateral one is the nucleus cuneatus. Okay, right. Now the fibers from dorsal root ganglion which will go to the medial nucleus and lateral nucleus. Now these tracts are called fasciculus cuneatus, fasciculus cuneatus and fasciculus gracilis. What is fasciculus cuneatus and gracilis? Now from the dorsal root ganglion, the fibers go to cuneate nucleus. Now these fibers are called fasciculus cuneatus. Fibers from dorsal root ganglion go to nucleus gracilis. That is called fasciculus gracilis. Now fibers from these two nucleus, they cross to opposite side. I told you the dorsal column nuclei, it is the second order neuron. So nucleus gracilis and the nucleus cuneatus is a second order neuron. Again, just now I told you the fibers from second order neuron cross to opposite side. Now fibers from nucleus gracilis and cuneatus now cross to opposite side. Now this crossing is called internal arcuate fibers. These crossing fibers are called internal arcuate fibers. Now the internal arcuate fibers after crossing, which in turn ascend as medial lemniscus. Which in turn ascend as medial lemniscus. Okay. So what is medial lemniscus? Now medial lemniscus is coming from, yes, very good, opposite side nucleus gracilis and cuneatus. Clear? Right. Now the medial lemniscus, the fibers which in turn end in thalamus, which nucleus? VPL nucleus, third order neuron. From there it go to sensory cortex. Error number 312. Clear? Yes. Now we're going to see applied. Now injury of medial lemniscus. Now injury to medial lemniscus, now where you see the effect? I told you medial lemniscus is coming from opposite side in nucleus gracilis and cuneatus. Now the effect is seen on opposite side. So please write injury to medial lemniscus. Injury to medial lemniscus. So patient have opposite side. Opposite side loss of fine touch, vibration, etc. So you can write any two sensory modalities can be dorsal column tract. Okay. Now injury to medial lemniscus, then opposite side loss of fine touch, vibration, stereognosis, joint sensation, position sense, accurate touch localization, conscious proprioception. Just write any two. Okay. Right. Now next one. Now injury to the dorsal column tract in the spinal cord. Then the no fiber is entering the spinal cord. So injury to dorsal column tract in the spinal cord. Now where is the effect? On the same side. So in this side, the loss of fine touch, vibration, etc. Clear? Now injury to dorsal column tract in the spinal cord means that no fiber enter the spinal cord in that side. Okay. So injury to dorsal column tract in the spinal cord. So patient have ipsilateral loss of fine touch, vibration, etc. Now one more point. Now see the diagram. I told you The nucleus for dorsal column is nucleus properus. Now this is nucleus properus. That is our nucleus properus. Okay. So nucleus properus, it is a nucleus for dorsal column tract. But most of the fibers are not coming to nucleus properus. Majority of the fibers, they ascend in the spinal cord and they go to medulla and they go to nucleus gracilis and cuneatus. Okay. So now nucleus properus, very few fibers come to nucleus properus. Again, why, sir? Now why very few fibers coming to nucleus properus? Now from the nucleus properus, now the fibers come to anterior horn. Fibers come to anterior horn and they in turn come out via spinal nerve. Okay. So fibers from nucleus properus will come to anterior horn and the spinal nerve carry the fiber. Now why, sir? Now why we have this arrangement? To maintain the reflux arc. To maintain the reflux arc. That is why we have this arrangement. Very few fibers come to nucleus properus, and so fibers from the nucleus properus come to anterior horn and via spinal nerve. Yes, now we have this arrangement to maintain the reflux arc. Okay, right. So now one more thing. I told you we have two nucleus gracilis and nucleus cuneatus. Now I told you nucleus gracilis is a medial nucleus and nucleus cuneatus is the lateral nucleus. Okay. So now we have nucleus gracilis medial and nucleus cuneatus lateral. Now please remember the mnemonic MLA. Now nucleus gracilis for lower limb and nucleus cuneatus carry the fiber from upper limb. This is very important. So I told you the mnemonic is MLA. So medial nucleus for lower limb. In the lower limb you see one muscle. Which muscle? Nucleus gracilis. Okay. And so nucleus gracilis which carry the fiber from the lower limb. Nucleus cuneatus carry the fiber from the upper limb. Okay. Right. So now nucleus gracilis which carry the fiber from lower thoracic part and then the lumbar part and then sacral and coccygeal segments. Okay, so nucleus gracilis carry the fiber from the lower thoracic spinal nerve, lumbar nerve, sacral nerves and the coccygeal nerves. Okay, whereas nucleus cuneatus, I told you, is a lateral nucleus for upper limb. So upper limb means which is carrying the fiber from the cervical part and the upper thoracic part. Okay, right. So that's all about nucleus cuneatus and nucleus gracilis. Now that's all about the dorsal column tract. Okay. Now next we're going to discuss the spinothalamic tract. Now we're going to see spinothalamic tract. Now spinothalamic tract, the first order neuron is coming from dorsal root ganglion. Now from the first order neuron, the fibers go to substantia gelatinosa. Now substantia gelatinosa, it is a nucleus for spinothalamic tract. Now I told you fibers from second order neuron. So substantia gelatinosa, it is the second order neuron. So fibers from dorsal root ganglion come to substantia gelatinosa, that is a nucleus for the spinothalamic tract, and that is the second order neuron. Now I told you the fibers from second order neuron cross to opposite side, and which in turn ascend as lateral spinothalamic tract and anterior spinothalamic tract. Again, name itself you have a clue. The lateral spinothalamic tract which ascend in the lateral white column and anterior spinothalamic tract which is ascending in anterior white column. Okay. Now the lateral and anterior spinothalamic tract. Okay. They go to thalamus. Now in the thalamus we have the third order neuron. Again, which nucleus? VPL nucleus. Now fibers from the thalamus which in turn give the fiber to primary sensory cortex, area number 3, 1, 2. That is the post-central gyrus. Now this is the spinothalamic tract. So first order neuron in the dorsal root ganglion. Fibers from first order neuron come to substantia gelatinosa. There is a nucleus for spinothalamic tract. Now that is the second order neuron. Now fibers from the second order neuron we know already, which cross to opposite side, and they ascend into lateral wide column and the anterior wide column. The fibers ascending in the lateral wide column, it is called lateral spinothalamic tract, and the fibers ascending in anterior wide column, it is called anterior spinothalamic tract. Again, second order neuron fibers, they end in third order neuron. Third order neuron is present in the thalamus, which nucleus? VPL nucleus of thalamus. Now from there, the fibers go to sensory cortex, primary sensory cortex. Now the point is, now lesion to spinothalamic tract. Lesion to spinothalamic tract, whether in the spinal cord or in the brainstem. Now where is the effect? See, the fibers entering the spinal cord and immediately they cross to opposite side and then they are ascending. So lesion to spinothalamic tract in the brainstem or spinal cord, where is the effect? Opposite side. Contralateral loss of pain, temperature, crude touch and the pressure. Okay, why? So any injury to the spinothalamic tract in the spinal cord or in the brainstem. Now where is the effect? Now these fibers are coming from, yes, opposite side. The fibers entering the spinal cord, they come to nucleus, the second order neuron, the spinal cord, and immediately they cross opposite side and then they ascend. Okay, so any injury to spinothalamic tract in the brainstem or in the spinal cord, where is the effect? Opposite side, contralateral side. Opposite side, loss of pain, temperature, crude touch and pressure. Clear? Right. That's all about the spinothalamic tract. Next, spinocerebellar tract. See, spinocerebellar tract, it is having only two order neurons. Only second order neuron is present. They are not having third order neuron. Why? Because it is spinocerebellar tract. It is not going to thalamus. Again, why? See, thalamus, it is the one which collects the fibers from the spinal cord and the second order neuron, which in turn give the fiber to the cortex. So thalamus, it is like a secretary to the cerebrum, which receives the fiber, and thalamus is give the fiber to the cortex, cerebrum. Now these tracts are going to cerebellum. Now we don't have any structure like thalamus for the cerebellum. The fibers directly go to cerebellum. That's all. So we have only first order neuron and second order neuron for the spinocerebellar tract. Now spinocerebellar tract, we have two, dorsal and ventral spinocerebellar tract. Again, as usual, the first order neuron, it is coming from dorsal root ganglion. Now fibers from first order neuron, which in turn come to Clock's column or nucleus dorsalis. Okay, so fibers from the first order neuron come to Clock's column or nucleus dorsalis, and that is the second order neuron. So fibers from the dorsal spinocerebellar tract, they reach the cerebellum through inferior cerebellar peduncle. That's all. Over. So dorsal spinocerebellar tract, it is not crossing. The only sensory tract which is not crossing, which is not decussating, is our dorsal spinocerebellar tract. Clear? Right. Now next one, our ventral spinocerebellar tract. Now ventral spinocerebellar tract, again first order neuron from the dorsal root ganglion and the second order neuron from the Clock's column or nucleus dorsalis. Now from the second order neuron, see the fibers are crossing. The fibers from the second order neuron which cross to opposite side and ascend in the ventral part of lateral white column as ventral spinocerebellar tract. Now the ventral spinocerebellar tract, again, which cross to opposite side, the ventral spinocerebellar tract, again, which cross to opposite side and enter the cerebellum via superior cerebellar peduncle. So our ventral spinocerebellar tract is crossing 2 times. One in the spinal cord, which cross opposite side and ascending. And again, finally, before reaching the cerebellum, which is crossed to opposite side and then enter the cerebellum via superior cerebellar peduncle. Now, why it is crossing? The ventral spinocerebellar tract, which gives information to the opposite side cerebellum too, which gives the fiber to the opposite side cerebellum too. Okay, so the ventral spinocerebellar tract, it is giving the fiber to the same side and the opposite side cerebellum. That is why we have this arrangement. Okay, now that's all about the spinocerebellar tract. Now we know the function of spinocerebellar tract. What is it? Now the function of spinocerebellar tract is which carry the unconscious proprioception fibers. Unconscious proprioception fibers. Is that clear? Any doubt? See, the complex part is the ventral spinocerebellar tract is crossing 2 times. Now why it is crossing 2 times? And now after crossing in the spinal cord, the fibers ascend. Now this fiber also give the fiber to the opposite side of cerebellum. And then before reaching the same side cerebellum, it crossing and via superior cerebellar peduncle, which enter the same side cerebellum. Okay, why? Because to give the fiber to the opposite cerebellum too. Okay, right. So that's all about the spinocerebellar tract.